Mr. Smith is a 65 years old who presented with dizziness and palpitations. It is a very common symptom and in fact is very disabling. Turns out Mr. Smith had been suffering for this for the past 2 weeks. He could not figure out why he was having lightheadedness, and sometimes his heart would feel racing. In other words, he had palpitation. Turns out the EKG, which we took at the office, showed atrial fibrillation. The heart rate keeps on going up and down when he's stressed. And at that moment, that day, his heart rate went up to 160. We gave him some beta blockers, which is a usual medication that we would give for atrial fibrillation. The other choice would be a calcium channel blocker, and used to, we would give digoxin. That's the first line of treatment, control the heart rate so as not to strain the heart so much to cause fatigue. So what happens when you have atrial fibrillation? What happens is your sympathetic tone is heightened. This is because of stress. Cortisol level goes up, sugar goes up, which in turn brings it to sympathetic tone, which in turn stimulates the hypothalamic pituitary axis. The hypothalamus produces ACTH, sends signal, the ACTH sends signal to the adrenals to produce cortisol. Cortisol is a stress hormone, which is the harbinger for inflammation and a lot of many different things, including acute elevation of blood pressure. You can also have hypotension if the heart rate is so elevated that it cannot sustain the pump of the heart to the systemic circulation. Well, Mr. Smith was given that IV intravenous drug or beta blocker and had to be switched to intravenous drip of cardizem, a calcium channel blocker which we usually use in the hospital. The heart rate goes down the following day. New medication, a long-acting cardizem, was given, and the drip, the cardizem drip, was slowly tapered off. Sometimes you add a beta blocker, metoprolol. This also has a significant effect on the sympathetic tone. It will decrease the heart rate and improve the sympathetic tone. Sympathetic tone. What is that? Sympathetic tone is the branch of the autonomic nervous system, sympathetic here, and parasympathetic. Sympathetic is a fight-flight that usually is provoked when you're angry, when you're frustrated, when you're ill, when you have fever. It heightens the amygdala when you have anxiety, as opposed to the parasympathetic tone where you're resting and digesting. You're properly absorbing nutrients, micronutrients. We're talking about the cellular level absorption of the antioxidants like the vitamins and the trace minerals. So this is what is a scenario. A lot of times atrial fibrillation patients will have diminished magnesium level. The contraction of the heart muscle is dependent, highly dependent on the trace elements like potassium and magnesium. So if you have persistent atrial fibrillation acutely, then that would be the tantamount effect, congestive heart failure. And that's what happened to Mr. Smith. Mr. Smith developed acute congestive heart failure. So what happens next? Well, the goal for Mr. Smith would be to prevent stroke, which is the anticoagulation, and to not tax the heart, keep the control of the heart rate. That's exactly what we did. Continue with the medication, and you can taper off the Lasix if you don't have signs of congestive heart failure. It's not meant to be given forever. You have to follow up the patient regularly, even weekly. In my practice, where I have concierge medicine practice, I follow up my patients as often as 2 days in 1 week and weekly thereafter until they become stable. That's the advantage of my practice. Less patients, but with good quality. So Mr. Smith got better, and so now we have anticoagulation or blood thinner, a beta blocker to control the heart rate. But I added something naturally to decrease the inflammation and to decrease the sympathetic overtone. Number one to comply and encouraged to practice was meditation. Mr. Smith complied with deep breathing, inhale 4, hold 4, exhale 8, and then hold. Why prolonging the exhalation? Because exhalation phase is where happening the heart rate decreases in rate and keeps the brain calm. So you need to exhale, prolong it, and then inhale 4, hold 4, exhale 8, hold 4. And then I added, because he's Catholic, I told him, do you practice meditation? He said, no, doctor, because I'm afraid. I don't like to go in meditation because I think it's against my religion, and rightfully so. Because all they think is meditation is the Eastern type, yoga, meditation, or the Buddhist meditation. Well, physiologically, the Eastern and the Western type of meditation gives you the same physiologic effect. It increases your circulation to the hippocampus and decreases the amygdala circulation, eventually allowing the hippocampus to grow. So he added it and incorporated his guided breathing to his meditation. He would go to the Adoration Chapel, which I encourage, and meditate on the unconditional love of Christ's passion, unconditional love of Jesus through his passion. So we started with the agony in the garden. I said, Mr. Smith, do this. When you inhale, you say, Jesus, Son of the living God, have mercy on us sinners when you exhale. Jesus, Son of the living God, have mercy on us sinners. And he did this. And he would do it for 10 minutes. So he sat. At 3 o'clock in the afternoon, I told him, I encourage you to do the Chaplet of Divine Mercy. And when you're reciting the Chaplet of Divine Mercy, you inhale when you say, for the sake of his sorrowful passion. Hold, 4. You exhale, have mercy on us and the whole world. You inhale, for the sake of his sorrowful passion. 4 counts. Exhale, have mercy on us and the whole world. This is a beautiful prayer, or a breath prayer. And you can incorporate the Divine Mercy Chaplet, which is very powerful. This is a recipe that was dictated to Sister Faustina to save the world and save many souls. If you pray the Divine Mercy Chaplet in front of a dying man, which I did when I was in hospice, I was very confident that the soul is going up, because Jesus promised that when you pray my chaplet in front of the dying person, of a dying soul, I will put barrier from Satan, that Satan cannot grab the soul and bring him to hell and bring that patient or the soul to heaven. So that's beautiful. So you have that. And then you listen to the breath. When you inhale, I did not open my mouth. I allowed it in my nose, and I hear the word Yahweh. Yes, Yahweh, the breath of life. When Adam woke up, the first sound was Yahweh. And if you appreciate the breath of life, you are adoring the Creator, God. He loves that. We are born to adore Him, nothing else. We're just mere creatures. God, our Father, deserves to be praised incessantly, and that's in the Revelation. Angels and saints unceasingly praising God. And we are to practice that, because better get used to it. In heaven, that is our task. So now, Mr. Smith got used to this breathing technique, and meditation tells me he's more drawn to go to the Adoration Chapel. And what's happening? Jesus, present in the Blessed Sacrament, is inviting him to go visit him regularly. Jesus was pleading to the priest to tell his fellow priest to adore him, because he's waiting, he's alone. Let alone, if there's no priest who's going to adore him, what will happen to the flock? But if you're the flock listening, encourage, do yourself, go to Adoration Chapel and invite friends and your family. And perhaps remind your priest. There's nothing wrong with that. We're all sinners and we're all frail. We are supposed to encourage ourselves. We have communion of saints among ourselves. In medicine, it's always drugs. But with medicine and faith, you cannot ignore the power of meditation. And if you care for the soul of your patient, encourage them to meditate on the passion of Christ. Through his passion, you would know Christ better. Saint Jose Maria Escrivá would say that repeatedly in many of his writings and his teachings. So, Mr. Smith started with his palpitation. Medication in acute symptoms, went home with oral medications, but now he's set to continue meditation. His heart rate variability, which can be measured in some gadgets, went up. Heart rate variability goes up when you meditate. That means your heart rate variability is up, your tone is in the parasympathetic tone. So less inflammation. What else is happening with Mr. Smith? I encourage him to practice the teachings of the church because he's Catholic. Just be reminded to fast. But the best way to fast is not to fast drastically and starve. I told him just do it little by little. First thing would be to fast from sugar. Well, mind you, sugar is the one that inflames or fuels the fire. It's like the gas. If you eliminate sugar, you eliminate a lot of metabolic dysfunction. Now I ask him, Mr. Smith, it's good to develop to put some corporal mortification and some penances in your daily life. We don't have to whip yourself and get nailed in the cross like in the Philippines we do it. You don't have to do that. You can do small sacrifices, exercise, and offer it for the Pope and the souls in purgatory. One step at a time. What is the reason why this is successful? Because when you exercise, BDNF increases, which is the brain-derived neurotropic factor. It's like a fertilizer of the brain, which works two ways and many more. It motivates you to exercise. So the more you exercise, the more you become attuned to exercise and you crave for the exercise. And what happens, the BDNF also increases the circuit regrowth of the pruned sheath, the myelin, the nerve endings, the synaptic endings. It regrows, which is pruned when you are stressed. There's normal pruning, but the pruning from the stress is deleterious because if it happens every day, you will develop memory loss and dysfunction of the brain. When you exercise, you improve the connections, so you think sharper. What happens to your mood? Your mood improves because your serotonin goes up. Remember, serotonin is 90% made in the gut. When you meditate, the gut microbiome flourishes. And a gut microbiome is responsible for many of your health, the good health. Sleep is important. You have to take care of the temple of the Holy Spirit, and that is your body. Rest. You better rest. I was a victim of sleep deprivation, not because I was gallivanting, well, maybe in the younger years, but I was sleep deprived because of my work. Hospital work for 7 nights, not good. I developed tachycardia, heart rate of 220, which is a piercing pain in the chest. And more or less, change your diet full of anti-inflammatory, extra virgin olive oil, 4 tablespoons a day, avocado, chia seed, all those power foods, like the blueberry, if you're not allergic to it or sensitive to it. Have your food allergy testing checked because that can be inflammatory if you're sensitive to it. At the center of this all, meditation. It healed my heart, it healed my soul, and it will also heal you. Mr. Smith achieved this, started fasting, did exercise, he meditated, and he was sleeping much better. As a consequence, he's more healthy. We're hoping that I can withdraw the medications of Mr. Smith, which I did already. I removed the diuretic because it's stable now. The heart rate is controlled, and I'm going to taper off the cardism, which controls the heart rate. So stay tuned. In the next episode, we'll be discussing about hypertension, which is related to metabolic syndrome, which predisposes patients to atrial fibrillation, how we can control hypertension in a very comprehensive way. And the center of this is meditation. Unconditional love meditation through Christ's passion. Remember, He loved us even before He was born, even before you were born. If you like this video, please drop a comment, like, subscribe, and please share, because there might be another soul that might be helped from this video. Thank you.